we have been a very cohesive section initially, and now a division since Mark's arrival. But before, we were working in silos. We were good at taking care of patients in a smaller community setting with less resources. We were able to take care of sicker patients in academic university setting, and these things would not talk or interact well with each other. People were not able to understand what's going on and what's needed on the other party's end. There were clashes, there were emotional outbursts, and I think so we have gotten away from them. Now practice believes that they are one team. They succeed as one, they fail as one.
Without teamwork, I would literally say you cannot take up any quality improvement initiatives. So we have undertaken so many quality improvement initiatives like involvement with Project Boost and the quality improvement efforts that are part of Project Boost, like improving care transitions, making those follow-up phone calls, making those follow-up appointments, doing teach back, and even developing this interprofessional bedside patient-centered model of rounding. We needed teamwork in all these efforts. So I would say I had to integrate teamwork in all quality improvement efforts.
So I was part of the Boost initiative here at University of Kentucky, and I worked alongside several different hospitalists to design the way that the floors were actually going to operate using the new item or interdisciplinary teamwork innovation model, rounds, and other tools that actually came from that Boost toolkit to actually improve patient care. We saw a significant improvement in the patient's understanding of what medications they were on and also what those medications were for, and the educational aspect of that for the patient was significantly improved. We're also seeing other very tangible benefits with workflow by positioning the hospitalist in the same office space as pharmacists and reducing that barrier of space that exists within just simple communication.
Another advantage with the item rounding is that we're having isolated incidents where there's been a problem or an issue. And really what I've noticed is that the team is coming together to solve those problems together. It's not just a physician issue, it's not just a nurse issue. They're collaborating, they're working as a team. And when they're needing to, they involve me. It's very exciting when they come in together and we're all talking in a little huddle about a situation that we need help on, and we're calling in our resources. That atmosphere wasn't existing when I was a nurse at the bedside. We just didn't have that opportunity. So it's not isolated silo work, it's together, collaboration, teamwork, and it's really made a big difference on how we function.
I think that we keep touching on patient safety because that's a really big thing, but I think that because of teamwork and because we're more collaborative and because personal relationships have been built, that if you make a mistake, it's easier for you to call the physician and say, hey, I've made a mistake, I've done these things. And prior to that, you were hesitant to call. You made the call, but it was very uncomfortable. And I think that now, if you make a mistake, it's easier to report it because you've developed those relationships, and we wouldn't have had those relationships had it not been for teamwork. You're not as scared to approach the physician.
I think when you said patient safety, I think patient satisfaction. I want them to come to UK, and I want it to be their favorite hospital in Lexington or Kentucky, and I want that to be facilitated through communication. I want them to feel comfortable with the doctors, and I want them to love the nurses, and I want them to just think that we're all on board together and that we all know what we're doing and that they feel safe and that they are satisfied.
An ongoing challenge, I think, with hospital medicine is going to be effective communication, and especially now with electronic healthcare records, it seems we're spending more time, face to face with a computer rather than with patients or with other team members. Clearly, the strategy going forward with patient-centered care is going to be the use of a multidisciplinary team. So I think hospitalists at the center of that, whether it's communicating with the nursing staff, communicating with patients, communicating with other specialists with the hospital system, is going to be effective communication. So I think one of the strategies we'll try to employ is how can we make our hospitalists the best effective communicators possible so that we can deliver them the best patient care.